Everybody, welcome to the first OCC webinar, What to Do in a Crisis. Today we are lucky to have Mike Crowtz to present this webinar. So I myself was very lucky to meet Mike Crowtz when I was working at Outward Bound. He was the risk management director back then. So Mike Crowtz has had extensive experience working in the field as a practitioner, experience managing outdoor programs, experience working with different types of population, and sorting out very difficult situations. So we're very lucky to have Mike with us today, all the way from Nova Scotia. And without further ado, Mike, I will hand this out to you.
Hey, Franz, thank you very much. Welcome everybody to the webinar, which we titled, Are You Ready for Your Next Crisis? And it was kind of a tricky title to think because, you know, we don't want to say that your next crisis is coming up or it's coming around the corner. But the point is that we don't know if and when it's ever going to happen, and therefore when we need to be ready. So there's a couple things that that I thought about when we were trying to create this webinar, and they were in the points of takeaways. So there's a few things that I thought were really important, and some things that I thought that people would be interested in if they are creating their own emergency action plan, or if they're editing their own emergency action plan, or if they've never heard of an emergency action plan. So the takeaways, if we're going to start this webinar, I'm going to talk a little bit about our brains during crisis. I'm going to talk a little bit about creating an emergency action plan. I'm going to talk about family and next of kin considerations and managing the media. And before I do that, I just want to prove to you that I'm a real person. Have I stopped the screen share? I think you can see me now. Is that right? I think so. So hi, everybody.
Yes.
Okay, so my name is Mike. So it's not just a robot giving this out, it's a real person back here. Okay, so I'm going to go back to my screen share. Here we go. So for the past 20 years, as Franz mentioned, I've worked in with a diverse range of populations and organizations. I worked in education, recreation. Currently, I'm working in healthcare. I've led wilderness expeditions across Canada. I've worked with youth from Florida street gangs. I led international safety audits and reviews for Outward Bound. I was a school teacher in a small Arctic community called Coral Harbor in Nunavut. I developed some innovative programs for seniors with intellectual and adults with intellectual disabilities and mental health concerns. I once even found myself de-escalating a crisis at about 30,000 feet on a return flight home from Peru. All those things that I mentioned before, it seemed that around every corner there seemed to be some sort of crisis, whether it was organizational or whether it was behavioral. So now I speak a bit. I do some risk management and crisis management consulting, and I train staff in de-escalation theory and techniques. I became a certified trainer in the MANT system of behavioral crisis interaction prevention, and I also am an active member on the certification committee for the Outdoor Council of Canada. So let's get into. There's, like I said before, there are a few things that I wanted to make sure that we hit on this, but I also want to reiterate a few times with this, the key message. And the key message is really important because crisis will largely turn out the way that we act during a crisis. And so if you think about crisis as being going up a mountain, and at the top of the mountain is crisis, and up one side is us escalating, and down the other side would be us de-escalating. And so we don't have to go up to the top in order to come back down. We can find the trails and paths across the mountain when we want to de-escalate a crisis. And the key message here is that when things go up, things go down. So when it goes up, that means that something else is going down. So when our pulse rate, our breathing, respirations, our endorphins or adrenaline, when those levels go up, there's a direct correlation at the exact same time. Our communication, our ability to communicate, our ability to reason, and compromising and listening, those skills go down. So imagine that pretty much any crisis that we're in, as soon as, even when you start thinking about it, if you can feel your heart starting to race a little bit and your breathing gets quicker, at that exact moment, your ability to communicate is starting to decrease. And I want to explain to you why that is in a couple slides, but that's a key message. Pulse and breathing go up, communication, reasoning, compromising, listening, all those things go down. So let's see. I want to start off with a little poll. I would love to know how many people are out there, I guess, and if the people that are tuned into this webinar, if you're working in the capacity and or volunteering in the capacity of outdoor education, if you're in the administration levels of that, if you're manager or
And Mike, if I may interrupt you for a second.
Please.
So most folks are viewing on YouTube, and to communicate with us, what you can do is use the comment section on the YouTube page. Also, if that doesn't work, we have sent you the email address for John, and you can send questions or comments to him, and he's gonna gather all of those and send them all the way to Mike.
Thanks, Franz. The way that we will eventually, so John and Franz are behind the scenes helping out. They're gonna come up, they're gonna pull that information and let me know what's going on so I can kind of tailor things to the people that are out there. I will pause periodically and answer questions. So please, like Franz said, use the comment section, and you can just type them up whenever they come into your head. We will pause later to answer them periodically throughout the webinar. I'm going to keep going. All right. So reiterate what you're going to learn. You're going to learn about our brain. We're going to talk about things we need to consider for an emergency action plan, family and next of kin, and working with the media. So at this point in time, if you have decided to answer my little poll, and if John and Franz have got them in time, now would be the time.
Yeah, so we don't have any compiled numbers yet from everybody on the webinar, but we can see that the comments on YouTube are working. So I'm seeing a fairly new field leaders. There's a few people that are all of the above, so I guess they got the hardest job of them all. And what's the last one that I said? Yeah, so I think actually a bunch of people are wearing different here, Mike. That's what we got with us today.
Okay. Thanks, John. That makes a lot of sense. I spent in this outdoor industry, end up doing all things, I think, a lot of the time. So let's get right into this stuff. So let's talk about our brain during crisis. Okay, so here's why I think this is important. If you think about our brain as the evolutionary onion, the further out parts of the brain are the more complex, and they deal with more complex tasks. The innermost workings of the brain are where our, I'm going to talk about two main things here. The amygdala, which is like our right in the middle of our brain, sort of, sometimes people call it the lizard brain or the ancient part of our brain. That's, our amygdala is in charge of emotional responses. That's the fight or flight. Whereas the prefrontal cortex is that part right in front of, just above our eyes, sort of, that front part of our brain. That's in charge of rational response and reasoning. So, for example, if you're out in the wilderness and you see a bear, the amygdala is going to give you an emotional response, which is fear. And from that fear, you're either going to run away or you're going to get ready with whatever you have, a big stick, and fight. Okay? So the prefrontal cortex is what allows us to rationalize whether those fight or flight responses are reasonable or not. So if we're in a zoo, for example, and we walk by and we see a bear behind a cage, our amygdala still tells us that there's an emotional response, which is, hey, I'm kind of scared of that bear. But our prefrontal cortex takes that information, adds some reasoning to it, and it tells us, hey, we don't have to be scared. You don't have to worry. There's a cage in front of us. So we've rationalized our emotional response. If all of a sudden by magic, the cages started to disintegrate and fell down in front of us, or something happened, the door swung wide open, then our prefrontal cortex would also tell us, hey, wait a second, things have changed. We are no longer able to reason away my emotional response, which is to get out of there because I might get eaten by a bear. So what happens in a crisis, this is really, really important. And this will, I think, I'll probably touch on it in more of the slides. What happens in a crisis is, like I said, when things go up, things go down. When in a crisis, there are chemicals, there are brain chemicals, there are catecholamines and cortisones and adrenaline and norepinephrine that are created or released, that are released from our amygdala. And what happens is those chemicals flush like this flood, right sort of from the amygdala up the back of our brain, and they flush right up into the prefrontal cortex. And what it does is it hijacks our brain. It hijacks the reasonable response or the rational response that we would have, that our prefrontal cortex is doing. So if you've ever been in a situation where you lost words, or you said something you didn't mean to say, or you acted in a way that didn't seem reasonable, there's a physiological reason for that. And the physiological reason, I'll say it one more time, is our amygdala, that fight or flight response, has hijacked our brain. So what we have to learn to do is get that reasoning back. So we can get that reasoning back by basically at the bottom heart, we can affirm our feelings. We can tell ourselves, yeah, I'm scared. And then we can choose our behaviors. I am going to freak out, or I'm not going to freak out about it. That's the way to get that control back of our brain. So if I was to use red light, green light here, what I'd like us to do going forward, or you to do, or what I would suggest that you do, is we can stop telling others or ourselves, hey, just calm down, because have you ever been in a situation in school or other place when someone told you to calm down? Did you actually calm down? That ever happened to you? Probably not. It's like, hey, just calm down, please calm down. It usually doesn't work. But what does happen, or what does work, is if we affirm our feelings, if we can help others affirm their feelings. I know you're angry, I know you're upset, I know you're scared, I know that you feel frightened. Then when our feelings are affirmed, we regain control and we can choose what we're going to do about it. Okay, so now, if there have been any questions up to this point, I'd love to answer.
Yeah, Mike, as of right now, we don't have any specific questions about your content. There was a question about will this be rebroadcasted or available at other time? And the answer is yes. We will edit this video and then post it on our YouTube channel, which will send you the link afterwards. As for questions about the webinar, I highly encourage everybody to just post questions as they come up on the comments section. John will gather them, and then at the right time, we'll send them back to you, Mike. So we might end up answering questions several minutes after, but we will answer them. And please note that there's a 5 to 10 second delay between us saying the words in the webinar and what is shown on YouTube. So that's another factor that makes that answering, we can't answer question right away.
Okay, thanks, Franz. I'm going to keep going. So now that we got, the reason why I want to start with the brain is because I want us to realize that there is some physiological stuff going on, and we have to, or we should be taking that into consideration, no matter what we do, no matter if we're creating or dealing with our emergency action plan in the middle of it, if we're talking to people, notifying the next of kin, or if we're dealing with the media, our brain is always going to be trying to fight or flight, and we want to keep in that rational space, because if we keep in that rational space, there's a better chance that we can manage our crisis more effectively. So let's do the emergency action plan. When I was doing consulting for Outward Bound, I used to travel around, well, sometimes actually around the world, Singapore and Indonesia. I've done some consulting and safety reviews in those countries. And when I talk to the instructors or when I talk to the managers, I used to like to ask a question. And I can remember there was one time in Singapore where we're in a motorboat going out to see a kayaking program that was happening. And I was talking to some of the instructors, and I said, I got a question for you. And I said, if you came to work one morning and somebody told you that someone had died or was really seriously injured, and there wasn't any other information, they didn't know what happened, they didn't know what the deal was, what would you think had happened? Where would your mind first go? And so I'm asking you that question right now for your programs. If somebody told you came in the morning and something had seriously happened, where would your first thought go? The reason why I ask this is because you can gain a lot of insight by our first response to that. The first response to that is usually where we feel like there's most risk, and where we should put most of our effort when we're talking about our risk management plan or our emergency action plan or dealing with crisis in general. So if you want to share what you think you would think is, you can go ahead and do that. If you don't feel up to it, you don't have to. It's a question that I'm asking you now, and a question that maybe you can ask yourselves or ask your staff even, or the people that you work with. Hey, if something happened tomorrow, what would you think it was? And that's where you can start to have a critical conversation, and that's where you can start to look for weak links in any of the stuff that you do. So I felt like that was one of the most important questions I used to ask. So in the emergency action plan, if you have one or if you don't have one, or if you've never heard of one, here we go. One of the things, somebody's question was, will it be rebroadcast? And Franz said that it would be. The other thing that I'd love to do is to be able to send you a link with this PowerPoint in PDF form. So you can take these points that I'm showing you right now and use those as a bit of a template to create and or edit anything in your emergency action plan. So to start out an emergency action plan, I think it's important to define what it is when we're talking about either a serious emergency or in this case, a field emergency. And so I'm going to read it right off. A serious emergency would be anything that would concern a fatality, a serious injury, missing person, extensive property damage. That would involve any of their staff, guests, or students, or clients, or whatever you happen to call them, and might involve outside resources. Okay, it's also an accident or incident or illness resulting in staff being in critical or serious condition, a physical or sexual assault, a participant or staff being lost for more than 12 hours, or the whole group out of contact or being lost for more than 24 hours. And I put question marks here for you because each organization is a little bit different. The threshold is going to be totally different. The groups that you're going to be leading will change these as well. So in other words, 12 hours might be for an adult group, whereas 1 hour might be for a kindergarten class, right? So question marks in there and allow you to either have those conversations or figure it out for yourself. So allow yourself to define that in your emergency action plan. Allow yourself to think about that. Another part of your emergency action plan should be a contact list. So if you're in the field, who do you contact? Or if the emergency is happening and you get the phone call or the sat phone call or whatever, then what order does the person who's responding to the emergency contact people in? And who are those people? And do you have their phone numbers? So take some time and make sure that you have a really good contact list. This should be posted either by telephones or keep it in your smartphone in your notes or your document section. If you're not going smartphone these days, when I was at Outward Bound, I used to carry around a binder, and in the binder was a whole bunch of information and contact information and phone numbers that I had, so I could look at the exact same thing that either a manager was dealing with and or the person in the field was dealing with. So I could have them all. On this list, this is a formal list. So in other words, in your organization, you might not have, and don't think that you have to have every single one of these 11 contacts that I came up with. You might not have a legal advisor or a specific medical or psychological advisor. If this is sort of best case scenario, if you had someone on your board who is a lawyer that was giving you legal advice, if you're a company that has insurance, then how are you going to contact them? So all this information on your contact list, really important, because you never know when you're going to need it. So the next thing in the field, in the field emergency, or in your emergency action plan, would be, how do you want your staff to respond? What do you want your field leader to do? And what's that first point of contact going to feel like? How's it going to play out? And what norms do you want to set up? So for example, you probably want to have the norm established that before they call, they're going to try to secure the situation. You want a norm. You definitely want it to be people's first instinct to start writing things down, any pertinent information. And you also, really important when those people phone in for that first time or call back, to have a prearranged norm of, if you get disconnected, if you have to leave your number on an answering machine, and even if you don't leave it on an answering machine, if you have to, the first thing that you could call in is, say, the nature of the situation, who's involved, what you've done, how they could possibly reach you, and then an agreed upon callback time, really critical in case you do get cut off or people aren't sure what's going on. So you kind of have this prearranged rules of engagement, if you will. Okay. So there you go. What to do during an evacuation. So while you're waiting for the evacuation team to assemble, someone should be obtaining some medical forms, health numbers, route plans, that sort of thing, getting that ready if you don't have it already. If you're a big organization, you want to send out a message to keep all the phone lines clear, so communication can come in and out. And you want to set up a system so you're able to document and log any of that information that's coming in. So I used to have little binders beside every phone, and in every little kit, if someone was on call for the night, they had a little ring binder with a zip around thing, and there was pen and paper, and there was notes, and there was predetermined questions that people could ask, so people could document and log all this information. We're going to be coming up to questions here in just a second, so if you have any, we can do that then. In the event that your evacuation is really serious and you have to fly either a float plane in or a helicopter for that matter, really important to have the latitude and longitude and or the grid reference of the pickup location. That needs to be communicated pretty quickly up front. The name, so people can try to find it on the map. Any local weather conditions, I can remember that being really important when I was leading a trip up in Nunavut, or actually in the Northwest Territories, on the Horton River. It's the most northerly river in mainland North America. And every time we called in, if we were going to have if there was an emergency, or even if we were just getting picked up, the pilots, the first question they want to know if we were okay, and then they wanted to know what the local weather was. They wanted to know what to expect when they got there. So that's pretty critical, because weather in the valley can be totally different than weather on the top of the mountain. Okay, let's see. Some considerations there about a helicopter landing pad if you have to create one of those, and what to do if you've never been around a helicopter before. There is a big downwash of wind that happens, so turn your backs, duck your head, where you kind of duck your head almost without even thinking about it. But you want to be able to keep working in this situation, so don't try to be macho and face into the helicopter. You don't want to get that debris blown into your eyes, and then all of a sudden there's another crisis because you can't work anymore because things have blown into your face. Okay, so at this point in time, if anyone has any questions about that, go.
Hey, Mike. Yeah, so before I go into the questions, which we have a few, I wanted to give you some answers from the poll that you asked. So what would people think first if there was a big accident? So a few of the answers included drowning, waterfront, some of it is car accident, in a senior home, somebody has a medical emergency, previous health issues. And there's also somebody else that wrote down that someone is trying to keep a secret. So they mentioned an accident, but somebody's trying to keep a secret. And I thought it was interesting because, that's another element to consider, the culture that you have in your organization. Can people talk about what actually happened or hide things from one another? So that's the gist of the answers that we received.
Thanks, Crowtz.
And then in terms of question, we had one question that somebody wanted to know what SAR stands for.
Okay. SAR is shorthand, search and rescue. Search and rescue.
And then, so I guess this is a little bit of a professional lingo. So I don't know if somebody had that question, but maybe also explain what SOAP note is.
Yeah, go ahead.
Yeah, so SOAP note is just when you do a first aid scene. SOAPs stands for subjective, objective, assessment, and patient. So it's a note that you would fill and helps you decide what to do with the person that's hurt. We also had another question asking about when would you contact parents in that process?
That's an excellent question. I have always found that the sooner you're able to contact them and give them as much information as possible, and then call them back with any new information, is always the best. So you don't want to call them and say something happened and we don't know what. Okay, you do want to call them if you have some pertinent information that you can tell them. And my experience has always been, I tried to rack up as big a cell phone bill as I could during those times in contacting parents, and almost to the point where they have had enough of me. So in other words, I'm telling them as much as I can when I can. I'm not ever trying to leave them feeling like they're not getting information. And they've always appreciated, whether it was just a check-in and telling you that we have no new information, but the situation is secure or whatever. So I guess the answer to that is twofold. When you have information, you can call and tell them. Don't call them and tell them that you don't know what's going on. Okay? Anything else there, Franz?
That's all I have for now. And as soon as I have more questions, I'll give them to you at the next question period.
Okay, super. It is 8:30. I have lots more stuff to do. I don't mind going over a little bit, and but let's just keep going. Hopefully, people are getting some information on this. So it's kind of, that question was really timely, I think, because the next thing that we wanted to talk about was considerations for when you do have to call the family. So let me give you some tips here. Okay, so I have a few bullet points that you can consider and that you can write right into your emergency action plan. So in other words, you can give yourself step-by-step of what to do or how to do it. And if I can reiterate one of the first points that I brought up, and that was about when things go up, when pulse, respirations, when those things go up, and the communication, active listening, reasoning, when those things go down, this is why you want to create your emergency action plan and or think about how you're going to talk to and or communicate with next of kin beforehand. So we want to have this document. We want to be really calm and collected when we write this, because when the crisis hits and it's time to pull that document off the shelf and dust it off a little bit, we're not thinking as straight, and we're not as good communicators as we were before. So that's why it's critical to do this before. So I guess, some things that I can tell you is that each occurrence or each crisis is going to be different. They all have seemingly unique circumstances, the first thing is sensitivity to the family, the feelings is really important. So we want to think about what we'll say before we make the contact. So have your facts really accurate and organized. Be sure to convey whatever personal condolences might be appropriate right off the top. Remember that next of kin have a right to all factual information. And especially pertaining to any kind of serious incident. But as the initial notification that you're going to, the first time you call and let somebody know that something's happened, that's going to be received with surprise and shock. So don't try to convey, any depth of details in that first, because they're probably not going to be able to take it in right away. So we can do that with a follow-up. The other, thing that's really important is try to be sensitive to the timing of your call. Try to think about maybe what the recipient will be doing. Are they at work? Are they eating? Are they sleeping? Also, try to anticipate any possible responses that you might have, or that they might have, and try to prepare yourself for that. And promptness, I think. Promptness is the next major consideration. Delays, if there's any kind of delays at all, remember that I think one of the first things I said is, as soon as you have information to give it, and then give information as it comes up, and even sometimes when you don't, any delays are likely to give rise to any more stress and bad feelings. Even though you have a million things to manage at that time, delays are going to give rise to stress and bad feelings. So one thing that you can ask if the family member has someone with them or close by to help comfort and support. You could consider inviting the family representative to come to the program area, or either the base or the area, whatever's most appropriate at the organization's expense. You'll be happy that you did offer to cover any expenses to get them there. And another thing that you might consider is having a staff member who has firsthand knowledge of the accident make a follow-up call with you, maybe with you or the spokesperson, whoever you've defined. So it's one thing to have a clear message, but also if there's someone with firsthand knowledge who is there, to be able to make a call as well. So long as their information and thoughts are organized and concise. And let's see. I guess, you know, what we're trying to really avoid is any uncoordinated efforts. So in other words, don't have different people from the organization calling at different times. Really try to coordinate all our efforts at the same time, so we have a united message and it's feeling organized. I think I have a few more here. I might have said those already. Generally, some advice that I can give you is A, to be consistent, of course. And generally, relatives and next of kin are notified of the incident after the participant has been evacuated or to the clinic, but they might not be. It might be when they're still in the field if it's a long evac. And you want to provide as much information as possible and arrange any kind of transportation home that you possibly can. And then follow up with a phone call to determine that the participant has arrived home safely and or whatever follow-up care might be needed. And if anything has changed. I once had a student on an Outward Bound course who had frostbite. And when I made the follow-up phone call the next day, we realized that the family could use some help and support in some getting a medical appointment. So we happen to have a surgeon who was on our board, and the two of us arranged to call, and this was a family from inner city Toronto who their son was on a course, and they didn't have a lot of personal means in order to be able to get to appointments and or clinics. So we arranged to have them take taxi into a doctor that our surgeon on the board had coordinated through, and took really good care of that person. And that happened because we were able to follow up with phone calls after. So there you go. Tons and tons of information about family and next of kin. And it's hard to fit it all into an hour. But if you have any questions, now would be a perfect time to go over any of those before we move on to the next.
Yeah, Mike. So first of all, there's somebody made a comment about some of the slides coming in and out of focus. I'm not too sure what the issue might be there. It might be your own connection, or it might be the YouTube channel. I know that there's a bit of feedback sometimes, so we're trying our best to reduce those issues. Everybody that participated in the webinar will receive the slides. So if you wanted to write down some notes and words came out of focus and you didn't have time, you will get the slides also with the recording. So there's no worries there. As for questions, so it's still connected with the family and next of kin. We had a question about how do you feel about parents talking to their children while they're in the field?
I've had some good experience with that. My advice is to be present when the phone call is happening. So the way that I've managed this before is that I've always been the first. I've been the person to initiate and end the conversation. So in other words, I would say, "Hi, Mr. Jones. I'm Mike. Blah blah blah. This is what's happening. I'm going to hand you over to your son Eric here, and but I'll be right here, and then I'd love to just check in with you or talk to you before you hang up." And I found that just providing a little bit of structure, I think, helps manage the situation. I think it's okay. And what I would advise against is walking away because you think that somebody needs some privacy. I think it's okay, in my experience, to stay there, to not interject, of course, allow the people to have their own opinions. But what sometimes can happen is it can get, there can be exaggerations, and if you're unable to hear what those exaggerations may or may not have been, then it becomes really hard later to try to manage those. So I'm okay with that, so long as that there's some structure. Good question.
As of right now, that's the only question that I can see. So you can continue.
Okay, thanks. We're moving on to the media. So let me talk a little bit about media. I have one slide here, but a bunch of things that I've written down that I kind of want to say. So let's see. The first thing about the media is being ready to know how to make a media release. So MarketWire is a good contact to have, because it connects to over 600 newspapers, TV stations, radio. Essentially, our hope, I guess what we want to do is we want our story to be, if the media is going to pick up something that's happened on one of your trips, we want it to be a one-day story. So we want it to be all over the news for one day, and then we want the news to have moved on to something else, so we can continue managing the situation, and so it doesn't blow up into a bigger story. When things become multi-day, there's new information that comes out. The first information was false. We don't know what's going on. That leads to frantic reporting when information is wrong, and then basically we want a one-day story. That's what we're going for. So in order to do that, we want to really cooperate with the media. We want, most media representatives are usually really professional and cooperative, if you deal with them in a straightforward manner. If you don't deal with them in a straightforward manner, if you are not providing all the known facts, if you're holding back information, then they don't appreciate that. They do respect, they totally respect when you hold information back, because it's subject to consideration of next of kin or protection of the injured or legal constraints. That is totally fine. But we should try to, basically the press wants to know what happened. They want to know where it happened. They want to know when it happened, who was involved. They want to know the names and personal data of the injured rescuers. And they want to know how you, as your organization, responded. So I'll say that again. They want to know what happened. They want to know where it happened, when it happened. They do want to know who was involved, including names. And they want to know how you, as your organization, responded to it. They're also going to want you to tell them how it happened. And we don't want to speculate, so we want to stick to the known facts, okay? We can say things like, until the incident review process is complete, we don't know all the factors. We can give them information. We don't want to speculate. We don't want us to say how we think it happened, because again, it's how we think. It's not what we know at this point. So we want to be upfront with them. We want to give them lots of information, but we don't want to speculate. And oftentimes they want you to speculate because they want a story, and we want it to be, from a public relations point of view, our objective is, like I said before, is a one-day story. We want to avoid the continuing series of headlines if these features dragged out for a period of days or weeks. So give them detail early is what I'm saying. Hesitancy or improper dealing with the press in an emergency, that basically only escalates the news coverage. and can be damaging in the long run. Let's see. Most of your dealings with the media will likely take place over the phone. And so if you can have a press release, if you can have that ready, you can email it or fax it or send it on your smartphone or whatever you have immediately, and offer to continue the conversation when they have it in hand. So you can start the first conversation on the phone, tell them you're going to send a press release, and then you can get back in touch with them. And then you can also read a prepared press release that lists the facts that would be approved by your director or your board or whatever. And you can have a spokesperson, someone who maybe is close to the organization or maybe part of the organization, but their job can be to remain composed while this is happening, and to speak on your behalf, because they don't necessarily, the spokesperson doesn't necessarily, they're not making the calls to the friends or the family or whatever, dealing with all the staff. They're just getting the information directly from what's happening, and then are able to remain composed. So you might want to consider that. Let's see. If you discover any information that was wrongly reported, you should provide the correct information as soon as possible. And if a reporter prints or broadcasts wrong information, then my advice is to contact the reporter right away, and not their boss, not their superior, and provide the correct information. So reporters like it best when you go to them and say, hey, I noticed you reported something that's wrong. Don't say, oh, that's wrong, I need to go and call the editor. Try them first. Let's see. When you're dealing with conflicting information, the spokesperson and or the director, you'll need to determine which version is accurate before you release it. And let's see. Yeah. Do I have anything else? Your press kit, if you have a press kit, it can be like a one-page sort of letter-esque that talks a little bit about the background of your organization. So are you a profit or not profit? Are you an educational organization? What's your mission? What do you try to address? Just a little bit about it, maybe some of the history, and maybe a little blurb on safety, that you have safety standards are maintained, blah, 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 that sort of thing. Yeah, so does anybody have, I'm open for questions about media.
So as of right now, I don't have any questions coming in, except for myself. I may, oh, wait a minute. I do have a question that just came in. So it's from June. There's a company called Road ID that manufactures wrist IDs, neck IDs, etc. with name, year of birth, family contact numbers, doctor numbers. Have you ever encouraged your participants to purchase such an item for your hiking trips?
That's a good question. I have not. I haven't heard of, and I've never used that.
Sorry, Mike, I think the sound wasn't that great. Can you repeat the answer?
Sure, I'll try again. I have not heard of, and I don't really have much information on that. I haven't used that before, and I don't really know a lot about it. So I wish I could give you more information on that.
Maybe a research project for later on. I personally do have a question, and you might have addressed it during the presentation. I was busy with a few behind the scenes things here, so I missed a bit of what you said. But do you have any suggestions if you see that the media story is veering in a direction that you don't like?
Well, that's a good question, Franz. You know, you're sort of at the whim of the media, in my experience. In other words, you can't direct the media. All you can really do is to give as much information as you possibly can, and it's the reporter who's going to paint the picture, whatever picture that they decide. They can take, you know, your quotes and paint them in one direction, or they can paint it in the other direction. I think, in my experience, building a positive rapport with the reporter, having them try to like you at the beginning, not being rude to them, being courteous, allows them to, I think, paint you, in my experience, in a more flattering way, instead of in a way that's maybe less flattering. Yeah.
Okay, perfect. Thanks, Mike. As of right now, I don't have any questions, but if we have more, I'll send them to you.
Okay. We're coming to the end here. We've got technically about 10 minutes left. You know, there's a couple things that I could recommend. I'd recommend that you create and keep a draft press release and keep it on file. So in other words, when we're calm and when we're collected and when we're rational, to spend some time to create basically a sample press release. So write a fictional story about your organization and about something that hasn't happened, that you would need to get out to the media, and have all of the information, have you know, your phone number at the end, have the fax, have the email, have it on your letterhead. Basically, you know, have press release on the top, have it ready to go, you know, the date at the top, and it might read something like, today's date, you know, Michael Crowtz, director of Out and Around Expeditions, announced that whatever, 8 students were, and I'm making this up, involved in a vehicular accident this morning at the railroad crossing near Smith's Cove in Nova Scotia. And then you might go on to say that the young students were in grades 11 and 12, and you might give some more information about that. And then you would say that 1 or maybe 2 of the students were transported by air to whatever hospital, and the rest of the students are being cared for by doctors at another hospital, or be examined or whatever. And then you can give information about, you know, your organization, Out and Around Expeditions, is presently assisting the parents of those involved in the accident to come and be with their children or join their children. And more information will be released as it becomes available. You might then want to say that Out and Around Expeditions is has whatever kind of risk management track record, and you know, and are known for providing rigorous safety procedures. And then you might say that Out and Around Expeditions is a non-profit, yada yada, whatever type of organization you are, and maybe a tiny bit of history. It was started in 1985 by 2 brothers who realized that getting people out in the sea, salt air, was beneficial, yada yada. So there, I just made up a sample press release for you. So the key part here is to have that ready to go, because when it comes time to write one, and like I said before, the key message, when the pulse, breathing, endorphins, adrenaline, when they're up, your communication, reasoning, compromise, your listening skills, they go down. So the last thing that you're going to be able to do, or going to want to do, is to sit down and try to write a well-crafted letter. So write it when you're relaxed, and then all you have to do during the crisis is to fill in that factual information of what actually happened, and you don't have to try to think about it all. So the last two things, I think, before we wrap up here, when you're notifying either the next family, next of kin, or the media, to have a script and talking points. So when they ask questions, you can remain on script in terms of what information you have or what information you don't have, so you don't get caught saying something that you'd regret or that you didn't mean to say. And the other information I would say during crisis is to stick to people's strengths. So just because maybe you're the director of the organization, if you're not the best person to be out in front of the media, then assign that to somebody else. Let people do what they're good at, capitalize on what people's natural strengths are. And I think that will help put you further ahead. So I do want to thank everybody for tuning in to the Outdoor Council of Canada's very first webinar. And I'd like to know if there's anything else to do.
And we want to thank you, Mike, for taking the time to help us with that and all the preparation that was needed for this webinar. Now, I know that you said this webinar is not about selling yourself and whatnot, but I do want to mention that Mike has a consulting business where he specializes in crisis and difficult situations and whatnot. So you can contact him through his website, or what's your contact info again, Mike?
It's you can contact at Mike Crowtz.
Can you repeat that? You were cutting.
Sure. Contact me at MikeCrowtz.com.